If you're on YouTube at all, then you probably know exactly how these iceberg charts work. Today I thought I would take a page out of MishKoz's book and explain an iceberg chart. For this iceberg, I want to do more than just read WebMD articles about these diseases, so I'll throw in a little bit of interesting information about them, mostly just historical tidbits. I would also like to disclose this chart was originally posted to r/iceberg charts by u/lobotomylover69. And I would also like to thank a fan of mine who is a med student and helped me out with research for this iceberg. So thank you, Ali, you made this video a lot easier. I'm also skipping the entire first 2 layers to make this video shorter, and also because everyone knows the diseases on those tiers. So starting off with tier 3, we have yellow fever. Yellow fever is just a viral disease spread by mosquitoes. It normally causes fevers, chills, and severe headaches, and in extreme cases and can cause liver damage and jaundice. Hence the term yellow fever. Jaundice is when your skin and eyes become yellow. And as it turns out, the Yellow Fever Commission, which was led by Dr. Walter Reed in the early 1900s, used human experiments, which included injecting themselves with the infected mosquitoes to prove the link between mosquitoes and the spread of the disease. Which is an interesting way to go about that, and you know what, props to them. It rarely shows up in the US at less than 1,000 cases per year at this point, but the disease still finds its way around Africa and South America. Epilepsy is a neurological disorder where abnormal brain activity leads to seizures or periods of unusual behavior. Its causes can range from brain damage to genes to just being unknown by the affected person. In the past, epilepsy was often attributed to demonic possession or supernatural forces, and it wasn't until the late 1800s that medical professionals actually decided, you know what, maybe this is actually a neurological disorder and not witchcraft. Epilepsy is pretty common, with over 200,000 cases a year, and it's more common than even autism. Leukemia is a type of cancer that affects blood cells, primarily the white blood cells, and originates in bone marrow. Like all cancers, this happens when the affected part of the body has a cell that mutates and then keeps growing. In the 1940s, aminopterin was one of the first chemotherapy drugs used to successfully induce remission in childhood leukemia, which opened the door to modern cancer treatment. Leukemia isn't that rare, but it also isn't common either. With less than 200,000 cases a year in the US, it is the 10th most common cancer, being 3.2% of new cancer cases. Parkinson's disease is a degenerative disorder of the nervous system which affects movement, and it's often characterized by tremors. The reason this happens isn't entirely known, but it's thought to be genes and environmental factors. Parkinson's happens in people over 60 for the most part, but there is such thing as an early onset Parkinson's disease, and it occurs in people under 50, but that is less common. Michael J. Fox, a famous actor from Back to the Future, as I'm sure you know, has Parkinson's and has become a prominent advocate for research and has raised hundreds of millions for the cause. Parkinson's is pretty common, being the second most common neurodegenerative disease in the US. And with that, I'm done with tier 3, and I should probably explain, yes, a lot of my stats are very United States/Eurocentric, because that's where most of the stats that I used for my research come from. So pardon if any of these diseases are far more or less prominent in other areas of the world. But unless I specify otherwise, assume the stats I'm talking about are from the Western world. Moving on to tier 4. Hepatitis is an inflammation of the liver, which is typically caused by viral infections like hepatitis A, B, or C. The variant most known to people is hepatitis B, which is pretty commonly vaccinated against, though if contracted can lead to liver failure. The most severe form of hepatitis is hepatitis C, which can cause jaundice and flu-like symptoms, but without treatment can go as far as causing liver cancer, cirrhosis, liver failure, and of course death. There is no vaccine for Hep C, but it can be treated if caught. Hepatitis C was only definitively identified in 1989. Before that, it was known as non-A, non-B hepatitis, which, given there are far more hepatitises than A, B, and C, this led to a lot of misdiagnoses. Hepatitis isn't rare at all, with B being the most common infection the liver can get. There are different types of hepatitis that are more common than others though, so while B is quite common, autoimmune hepatitis on the other hand is relatively rare. Typhus is a bacterial infection which often causes fever, headaches, and rash. The infection was known to get as bad as causing pneumonia, gangrene, and respiratory failure. There are also different types of typhus depending on what creature is giving the typhus, with endemic typhus coming from fleas, epidemic typhus coming from body lice, and scrub typhus coming from chiggers. And I swear that's not like a racial slur, it's a kind of bug. During World War II, the Nazis actually used typhus as a method of genocide, and would intentionally spread it among prisoners in camps using fleas. Nowadays, typhus is a very rare disease in the United States, with them only reporting about 300 cases every year. Gonorrhea is a sexually transmitted bacterial infection affecting the reproductive tract, throat, and eyes. People with gonorrhea can expect to experience pain in the lower abdomen, pain during urination, and fevers. In fact, in the Tuskegee syphilis study, the subjects of this study also had gonorrhea. Let's just say it was treated the exact same way syphilis was treated in that study, which we will be talking about that more when we get to syphilis. The clap, which is a name for gonorrhea, is pretty common with over 3 million cases in the US per year, but it can also be treated pretty easily. H1N1 is also known as the swine flu, which is a strain of influenza that is caused by coming into contact with pigs that have the virus. Symptoms of this disease are mostly flu-like, but at their most severe can cause pneumonia, seizures, bronchitis, and bacterial infections, which can kill you. The H1N1 pandemic actually prompted governments to quickly produce vaccines, but some rushed vaccines caused rare cases of narcolepsy in recipients, especially in Europe. Swine flu is pretty rare nowadays, with less than 200,000 cases in the US per year. And if you heard that and think I'm an anti-vax or something like that, I'm not, as you'll come to find out later in this iceberg. That was just a fact I found interesting, that rushed vaccines caused narcolepsy in Europe. Chlamydia is a common sexually transmitted infection that often shows no symptoms, but it can lead to severe reproductive issues if untreated. For women, this can include pelvic inflammatory disease, which in turn causes chronic pelvic pain, infertility, and can even cause ectopic pregnancies. Ectopic pregnancies are, of course, when the fertilized egg implants itself in anywhere that isn't the uterus. Most commonly in the fallopian tube, but it can happen in more bizarre places like the ovary or the cervix. In men, chlamydia can cause infection in the testicles and in the epididymis, which can be very painful and cause swelling. Reduced fertility is also a risk in leaving chlamydia untreated in men. An effect that can happen in all the genders is an increased risk of HIV. The ancient Roman texts actually describe diseases that resemble modern-day chlamydia, which means people probably have dealt with this for over 2,000 years. I mean, you know the ancient saying, the Greeks invented orgies, the Romans added women. Chlamydia is pretty common, being the most common STI in the US, with over 1 million cases in the US in 2022. And with that, I'm done with Tier 4. We're going to move on to Tier 5, but I've decided I'm not even going to acknowledge when I'm done with the tier because there are so many tiers to this and there's only like 4 listings per tier, so that would get kind of old. Leprosy is a chronic bacterial infection that primarily affects the skin, nerves, and respiratory tract. It starts out pretty tame with tingling in the limbs, weakness, congestion, nosebleeds. It, however, is known for causing severe disfigurement in its advanced stages. Hansen's disease is actually its more preferred name now. Leprosy is actually featured in the thumbnail of this video, right next to the person with Stoneman syndrome. Get ready for Stoneman syndrome, that one's wild. Hansen's disease is pretty rare, with less than 20,000 cases per year, and if treated early, the disfigurement part can be prevented altogether. H5N1 is a strain of avian influenza that occasionally infects humans, which causes severe respiratory disease. As the name implies, contact with birds that carry the strain leads to people getting it. Despite fears of a pandemic, H5N1 rarely spreads between humans, though its 50% mortality rate makes it one of the deadliest flu strains when it does infect humans. Bird flu is super rare with less than 1,000 cases per year, though as I am making this, someone tested positive without even being exposed to animals, so that statement could age poorly. Syphilis. Syphilis is a bacterial infection that's usually spread through sexual contact, which progresses in stages and can cause long-term complications. Syphilis, as it turns out, comes in waves. The first wave comes within 3 months of contact, and it's characterized by sores on the body that are hard and painless. Ideally, after this wave, one would receive treatment and just stop it there. If you don't get it treated though, the second wave will come, usually 1 to 3 months after the first wave, and it'll put rashes all over the body and induce feverish symptoms like swollen lymph glands, sore throat, and headaches. And it can also even induce hair loss. Most of the people who get syphilis and do not treat it will just have it end there, but some will experience the final wave, which comes years after the second infection, up to 15 years. But when it does, it goes right for the organs. Syphilis will attack the ears, the eyes, the heart, and the brain, which can induce mood swings, hearing loss, blindness, and dementia. And so here's where I talk about the Tuskegee syphilis experiment, where African American men were intentionally left untreated for syphilis even after penicillin became a known cure, because I guess we just had to know what syphilis did to people when we didn't treat it, even though we could perfectly just treat it right there. Syphilis is rare and can be treated really easily if caught early. And even in the times those men were experimented on, could it be treated pretty easily? Really just evil work all around. Alzheimer's disease is a progressive neurodegenerative disease that causes memory loss, confusion, and eventually the inability to even perform basic daily activities. This is a disease that just affects old people, and it's known to be passed on genetically, but it can also be exacerbated by environmental factors. And no, it's not my intention to be insensitive by playing Everywhere at the End of Time while I explain this one. This is the disease that is meant to be portrayed by the album in question. It is a very fascinating album, and I'll link a video essay about it in the top right corner. Alzheimer's is very common, being the most common form of dementia. Tapeworm infection is caused by ingesting larvae of a tapeworm, and it can lead to abdominal pain, malnutrition, and in severe cases, neurological issues. Where you may have heard of tapeworms was that one fad where people would intentionally swallow tapeworm eggs in order to lose weight and just not even think about the risks of putting a parasite inside of your body. And with that, it was typically more common for you to just be malnourished as a result of this diet, as I'll be calling it, rather than actually losing weight. Tapeworm infections are pretty rare though, with less than 200,000 cases a year. Tetanus is a bacterial infection which is characterized by muscle stiffness and spasms, and it's often contracted through cuts or puncture wounds. The tetanus bacteria, which is found in soil, can survive extreme environmental conditions, which makes it very persistent in nature. And yes, I did just say it's found in soil. A lot of people seem to think that it's just found in rust, or at least know it to be found in rust, but really just the environment can carry it. So clean your wounds, guys. Tetanus is extremely rare with less than 1,000 cases per year, and if caught early with the vaccine, it can be prevented. The Black Death was a devastating pandemic in the 14th century that killed millions, caused by the bacterium Yersinia pestis, which was spread by fleas. The bacterial disease that caused the Black Death is known as the bubonic plague. The bubonic plague starts out with swollen lymph nodes in the neck, armpit, and groin, but then it goes as far as you coughing up blood and necrosis on patches of skin. The Black Death is believed to have killed 30 to 60% of Europe's population in just a couple years, which led to widespread social and economic upheaval. And it's called the Black Death because of the black coloration of the buboes that would show up on a person's skin if they had it. And it is unspeakably rare nowadays, being treatable with antibiotics. Cholera is a bacterial infection of the small intestine, which is usually contracted from contaminated water. The bacteria is known to cause diarrhea, which in turn can lead to severe dehydration and can kill people if it's not treated. The severe dehydration that would be caused by this bacteria leads to a blue coloration of the skin, which is where it gets its more common nickname, the Blue Death. With less than 1,000 cases a year, cholera is extremely rare. Smallpox is a viral disease that causes fever and a distinctive skin rash, with a high mortality rate killing around 3 in 10 of those infected. The symptoms start off flu-like with body aches and fever, but then it goes on to leave blisters all over the body. Smallpox was the first disease to be eradicated globally through vaccination, with the last natural case occurring in 1977. People never get smallpox nowadays, which is quite a tell of how far we've come with medicine as a society. I can't be sure about this never happening again though, because strains of the virus are still being used for research. Ebola is a highly contagious virus which causes severe hemorrhagic fever, with mortality rates reaching as high as 90% during outbreaks. As with most viruses, the transmission method is contact with anything infected, and I should probably define hemorrhagic fever, which is a fever which causes internal bleeding along with all the other fever symptoms. If you're old enough to be watching my videos, you might remember the 2014 to 2016 Ebola epidemic in West Africa that killed more than 11,000 people. But it also did accelerate the development of vaccines for the virus, and thus that put an end to all the tabloids scaremongering about if Ebola was going to kill us all. Ebola is pretty rare, but outbreaks are still known to happen in Africa. Lassa Fever is a viral hemorrhagic illness spread by rats, and from there about anything a virus can infect. About 80% of the people who get this virus just get mild symptoms like weakness and slight fever and just go undiagnosed. Severely affected people who get the virus, though, are likely to experience symptoms such as bleeding, swelling, vomiting, and it can even kill them. Pregnancies are also known to be ended by this virus, with a mortality rate of about 95% for fetuses. Lassa fever was first identified in 1969 in Nigeria, and its name comes from the town where the first cases were documented. Lassa fever is not known to be rare where it originates in West Africa, where hundreds of thousands contract it a year, but outside of Africa, Lassa fever is quite rare, and the cases that do happen come from West Africa. COPD, or chronic obstructive pulmonary disease, is a group of lung diseases which includes emphysema and chronic bronchitis that block airflow and make breathing difficult. It is primarily caused by long-term exposure to irritants, which is most commonly cigarette smoke. Despite being a leading cause of death worldwide, COPD is often underdiagnosed, especially in low-income regions where access to healthcare is limited. COPD is very common with over 3 million cases a year. Rabies is a viral infection transmitted through the bite of an infected animal. It causes brain inflammation and is almost always fatal once symptoms appear. These symptoms essentially make you feral and include delirium, hallucination, muscle spasms, paralysis, aggression, brain death, and even a hydrophobia, which is the fear of water. The rabies virus has the highest mortality rate of any disease, nearing 100% once symptoms develop. However, the rabies vaccine, if administered early, is nearly 100% effective on the flip side. Rabies is extremely rare with less than 1,000 cases per year, but the cases that do happen are horrible. Measles is a highly contagious viral infection that causes a skin rash, fever, and respiratory symptoms. It can lead to severe complications including pneumonia, brain swelling, and death. Despite the availability of a vaccine, measles have surged in recent years due to declining vaccination rates, particularly in communities influenced by the anti-vax movement. Measles is very rare, with less than 1,000 cases per year, but it might not stay that way. As I've mentioned, a bunch of dumb who think they're smarter than science are helping to bring measles back. Emphysema is a form of COPD that damages the air sacs in the lungs, reducing oxygen exchange and causes breathlessness. Emphysema can often go unnoticed in its early stages, since breathlessness might not be something that immediately makes someone think emphysema. Alfred Nobel, the inventor of dynamite, actually suffered from emphysema, and it's kind of funny that the man who invented an explosive that was used in war was ultimately undone by an air pollutant-related disease. Emphysema, being a form of COPD, is very common and sticks around for life, though it can be mitigated by treatment. Polio is a viral infection that can cause paralysis and respiratory failure and death. It mainly affects children under 5 years old, and many survivors of polio were famously confined to machines known as iron lungs to keep them alive. As it turns out, the 32nd president of the United States, Franklin Delano Roosevelt, had polio, which paralyzed his legs, but he would use leg braces to prop himself up during speeches to give off the illusion that he could stand, so that way he didn't look weak, because something about the optics of a US president who couldn't stand on his own just weren't great for the time. The last recorded case of polio in the wild in the Americas occurred in 1991, but the disease still persists in countries like Pakistan and Afghanistan due to vaccine misinformation and poor healthcare access. Chikungunya is a viral infection spread by mosquitoes, causing severe joint pain, fever, and rashes. While it's usually not fatal, it can cause long-lasting arthritis-like symptoms. Chikungunya comes from the word in the Makonde language meaning to become contorted, referencing the stooped posture of those suffering with the severe joint pain. Chikungunya is rare to the west, but in tropical areas like Africa, Southeast Asia, and India, it's quite common. Lupus is an autoimmune disease in which the immune system mistakenly attacks healthy tissue. It can affect the skin, joints, kidneys, brain, and other organs, leading to chronic inflammation and damage. In some cases, patients need to go under dialysis because lupus attacks their kidneys to the point where they start to fail. Diagnosing lupus can take years because its symptoms mimic other diseases, which leads people to call it the great imitator. I actually had a friend in middle school who had lupus, and he was gone half of the time because he had to have dialysis. I don't know where that guy is now, but I hope he's doing alright. Lupus is not common, but it's also not particularly rare, with 72 out of every 100,000 people having lupus. Zika is a mosquito-borne virus that typically causes mild symptoms like fever and rash, but it can lead to severe birth defects such as microcephaly when pregnant women are infected. Microcephaly is when an infant's head is much smaller than would be expected, not to be confused with anencephaly, which we will be touching on later. The Zika outbreak in 2015 led to a rise in babies being born with underdeveloped brains, causing an international health crisis, especially in Brazil. Zika is quite rare to the northern hemisphere, normally only showing up when a traveler brings it with them, but it is more common to the southern hemisphere, mostly in South America and Africa. Legionnaires disease is a severe type of pneumonia caused by Legionella bacteria, which can thrive in warm water systems like air conditioning units and plumbing systems. Legionnaires can be fatal along with other forms of pneumonia, so definitely get that treated if you end up getting it. The disease got its name after a deadly outbreak at an American Legion convention in 1976, affecting attendees staying at a Philadelphia hotel. Legionnaires disease is very rare, with less than 20,000 cases occurring every year. Tuberculosis, or TB, is a bacterial infection that primarily affects the lungs, which causes coughing, chest pain, and weight loss. It's spread through the air when an infected person coughs or sneezes. Tuberculosis was actually once known as consumption because of the severe weight loss it caused in its sufferers. It was romanticized in literature and art at the time, even though it was pretty deadly. TB is pretty rare with less than 200,000 cases showing per year, but those are the cases that make themselves known. TB stays dormant for a long time before actually showing symptoms, so either that or it can just stay dormant forever, so we won't really know the extent to which TB goes. River blindness is a parasitic disease spread by the bite of black flies. It causes severe itching, skin discoloration, and blindness. The parasite's larvae invade the eyes, which leads to long-term damage. River blindness is actually the second leading cause of infectious blindness globally, after trachoma, and is primarily found in sub-Saharan Africa. River blindness is rare to the Western world, but it is a prevalent problem in Africa and Latin America. Marburg virus is a highly infectious hemorrhagic fever virus, similar to Ebola, which causes internal bleeding, organ failure, and high mortality rates. In the cases where people die to Marburg, death normally happens within 8 to 9 days because of shock and just the severe blood loss that this disease brings. The virus is actually named after the city of Marburg, Germany, where laboratory workers were infected in 1967 by monkeys they imported for research on polio. Outbreaks are known to happen in sub-Saharan Africa, but it is a rare disease anywhere else. DIPG, or diffuse intrinsic pontine glioma, is an aggressive brainstem tumor that primarily affects children. It is highly resistant to treatment, and the prognosis is poor, with most patients surviving less than a year. Despite significant research into brain tumors, there has been little progress in treating DIPG, and no significant advances have been made in over 40 years. DIPG is a very rare disease and primarily affects children. Again, if you're watching this and you are old enough to even understand what was just said, then you aren't getting this one. Brucellosis is a bacterial infection transmitted from animals to humans through raw dairy products or direct contact with infected animals, which causes fever, joint pain, and fatigue. Brucellosis can do a lot more than that though if it's left untreated. Then it can cause infections in the heart, memory loss, depression, and swelling of the liver. Brucellosis is often called undulant fever due to its cyclical fever pattern, and it can last for months or even years if untreated. Brucellosis is very rare in the United States, but it is more common in Southern Europe, as could probably be gathered by its other nickname, the Mediterranean fever. Anthrax is a bacterial disease affecting animals and humans, often transmitted through spores found in soil. In humans, it can manifest in cutaneous, inhalation, or gastrointestinal forms, with inhalation anthrax being the most lethal. Anthrax is known to cause blistering, swelling, black sores on the face, arms, neck, and hands. And if injected, anthrax can cause abscesses underneath the skin. As I'm sure you're familiar actually with this, in 2001 anthrax spores were sent via mail in the United States, leading to 5 deaths and creating widespread panic during the post-9/11 atmosphere of bioterrorism fears. Anthrax is extremely rare and typically only has outbreaks in animals unless someone is intentionally using it as an instrument of bioterrorism, which, as I mentioned last time that happened, was in 2001. Neuroblastoma is a cancer that develops from immature nerve cells, primarily affecting infants and young children. It often begins in the adrenal glands, but it can spread to other areas of the body. Neuroblastoma is one of the most common cancers in children under 5, and its cause is still largely unknown, which makes early detection difficult. Neuroblastoma is another extremely rare disease, but despite that label, it is the most prevalent cancer in infant babies. Lou Gehrig's disease, or ALS, is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord, which leads to loss of muscle control and eventually paralyzes who has it. It's named after the baseball legend Lou Gehrig, who was diagnosed in 1939. ALS is also the focus of a bunch of awareness campaigns, including the famous Ice Bucket Challenge, where the shock of the ice water hitting the person and that frozen state the person is in once the water hits, meaning to represent the paralysis that someone with ALS is living through 24/7. ALS is considered rare with an incidence rate of about 1 to 3 people per 100,000. Hydrocephalus is a condition where excess cerebrospinal fluid builds up in the brain's ventricles, putting pressure on the brain. Cerebrospinal fluid in the brain is supposed to be there as it removes waste from the brain, protects it from damage, and provides the brain with nutrients. It's when the brain fails to get rid of excess fluid when problems start to occur. It can cause head enlargement in infants and severe neurological damage if untreated, and can even be fatal. Hydrocephalus is often called water on the brain, but as mentioned, it's actually cerebrospinal fluid and not water that causes the swelling. Hydrocephalus is not common but not all that rare either, with its higher incidence rates being 88 per 100,000 children and 400 per 100,000 adults over 80. SIDS, or Sudden Infant Death Syndrome, is the sudden and unexplained death of an otherwise healthy infant, usually during sleep. The exact cause of this is unknown, but it's thought to involve issues with the baby's breathing or arousal from sleep. Public health campaigns to promote back sleeping, which would be putting them to sleep on their backs, have significantly reduced sudden infant death syndromes since the 1990s. Sudden infant death syndrome is quite rare, affecting 2,300 babies a year in the United States. Pica is an eating disorder in which individuals compulsively eat non-food items such as dirt, chalk, or hair. It is often linked with mineral deficiencies or developmental disorders. Some people with pica have been known to ingest harmful objects like nails, glass, and sharp items, which can lead to life-threatening internal injuries. The novel concept of people eating non-food things leads people with the disease to be put on TV shows for their condition to be laughed at. Pica really isn't all that rare, mostly showing up in children and pregnant women. And it also doesn't seem to have that high of a death rate, so I'm not entirely sure why it's this deep on the iceberg, but I didn't make it. Elephantiasis is caused by parasitic worms transmitted through mosquito bites. It leads to extreme swelling of limbs, which results in thick, hardened skin. Elephantiasis, or lymphatic filariasis, affects over 120 million people worldwide, mostly in tropical regions, and is a very stigmatizing disease due to the disfigurement it causes. Elephantiasis is normally rare in North America and is far more common to tropical and subtropical areas, as would be expected in mosquito-borne illness. Neurofibromatosis is a genetic disorder that causes tumors to form on nerve tissue, which can develop anywhere in the body, including the brain and spinal cord. The condition is best known through someone known as Joseph Merrick, who was given the name the Elephant Man, although it is now believed he had Proteus syndrome rather than neurofibromatosis, so it is pretty weird that one of the people that is most known for having this disease didn't even have it. Neurofibromatosis is quite rare and only affects 1 in 2,500 people. But also shout out to that one person in my audience who has it. Godspeed. Brittle bone disease is a genetic disorder where bones break easily, sometimes with little or no apparent cause. The severity can range from mild to life-threatening. Some cases of child have been mistaken for brittle bone disease, and also cases of brittle bone disease mistaken for child abuse, which can lead to some tragic stories, such as in the year 2000 when a Miguel Velasquez had his daughter taken away from him after she was taken to the hospital for broken ribs, and then Child Protective Services took away his daughter because the courts thought that Miguel had been abusing his daughter. Miguel's wife Alice pleaded that brittle bone disease runs in the family, but the courts just didn't listen, charging Miguel with felony child abuse and put the daughter in foster care. But after an 18-month legal battle and a test finally being administered for brittle bone disease, the test turned out positive, at which point she was returned to her parents and the charges against Miguel were dropped. The family received a settlement of $950,000 for their trouble in the end of it all, but it really could have all been prevented if they tested for the disease that they had said she had to begin with. As for the rarity of brittle bone disease, it is very rare, with only 0.01% of the world population having it. Addison's disease is a rare disorder where the adrenal glands do not produce enough hormones, particularly cortisol and aldosterone. Symptoms include weight loss, low blood pressure, and fatigue. This actually isn't even the first time Addison's has been brought up on this channel, being brought up in the Human Pet Guy video when Mr. Cybersmith was talking about an experiment where he wants to drain hormones from the human body, or whatever sick fantasy he was on about on that particular day. Addison's disease is quite rare, with 1 case per 100,000 people, but it's hard to know for sure how rare it is since it can often go undiagnosed. Prader-Willi Syndrome is a genetic disorder that causes a constant sense of hunger, leading to chronic overeating and obesity. Other symptoms include developmental delays and learning disabilities. This constant sense of hunger is entirely in the mind. The belly can be as full as it can be, but the mind will still be acting as if it is starving to death. People with Prader-Willi syndrome can eat uncontrollably and have been known to consume spoiled or even inedible food for their consumption to eat. Many people think that the hungriest man in history, Terrare, had Prader-Willi syndrome, but that just isn't true, as people with Prader-Willi do not need the food that they crave, whereas Terrare literally collapsed during war from not eating, despite being given quadruple rations. There is, however, a headline that recurrently goes viral, which entails a mother needing to lock her obese child out of the kitchen. Every time this goes viral, commenters are quick to blame the parents for letting the child get like this, but they don't have the full context, as the kid, I'm sure you can guess by me bringing her up in this section, has Prader-Willi. Really sad when sensationalism will just usurp the context out of a story, and it'll lead people to the worst conclusions despite not even knowing a little bit of the full thing. Prader-Willi syndrome is quite rare and affects only 1 in 10,000 people. Scleroderma is an autoimmune disease that causes hardening and tightening of the skin and connective tissues. It can also affect internal organs and the digestive system. While the exact cause of scleroderma is unknown, it primarily affects women, and its symptoms can range from mild skin thickening to severe organ damage. Scleroderma is quite rare, with 25 cases per 100,000 people in the United States. Muscular dystrophy is a group of genetic diseases that cause progressive weakness and loss of muscle mass. The most common type, Duchenne muscular dystrophy, primarily affects boys. There is no cure for muscular dystrophy, but treatments such as physical therapy, medications, and surgery can help manage symptoms. Muscular dystrophy is rare, with 25 cases per 100,000 people in the US. Conjoined twins are identical twins whose bodies are physically connected due to an incomplete splitting of an embryo that would have become identical twins that are separate. Depending on the type and severity, they may share vital organs, and also depending on the severity, conjoined twins can also be surgically separated. Historically, conjoined twins were often showcased in freak shows, the most famous being Chang and Eng Bunker, the Siamese twins who were born in Thailand in 1811. Conjoined twins are very rare, and most of the cases that do happen die within 24 hours of childbirth. Flesh-eating disease is a rare but severe bacterial infection that destroys tissue under the skin, spreading rapidly and causes extreme pain. The disease normally enters the body through wounds, and amputation is often necessary to stop the spread. Despite the name, flesh-eating disease is actually not caused by flesh-eating bacteria, but by a bacteria that releases toxins that destroy tissue. Flesh-eating disease is very rare, though the immunocompromised are more likely to catch it since it enters via cuts and other openings in the skin, and so a weaker immune system would have a harder time catching it. Aquagenic Urticaria is a rare condition where exposure to water causes hives and painful rashes. Even drinking water can trigger a reaction in severe cases, although this occurrence is far less common with people in this condition. It's also known as the water allergy, and aquagenic urticaria's case is still largely unknown. Aquagenic urticaria is very rare, affecting only 1 in 250 million people. Hyperdontia is a condition where individuals develop extra teeth beyond the normal set of 32. These additional teeth are often malformed and can lead to dental complications. In some extreme cases, people with hyperdontia can develop over 100 extra teeth, which will lead to extremely painful surgeries to remove them. Hyperdontia is less rare, with 1 to 3% of the US population having it. Teratoma is a type of tumor that can contain fully developed tissues and organs, including teeth, hair, and even eyes. Teratomas are most commonly found in the ovaries or testicles. The word teratoma comes from the Greek word teras, meaning monster, because of the shocking appearance of some of these tumors that can resemble a malformed person or creature. Teratomas are the most common tumor to occur in newborns, but despite that label, they are still uncommon, occurring in 1 in 30,000 live births at most. Brain-eating amoeba is a microscopic amoeba that lives in warm, fresh water. When it enters the body through the nose, it can travel to the brain and cause a deadly infection called primary amoebic meningoencephalitis. PAM starts off with headaches, fever, nausea, and vomiting, but it is a brain-eating amoeba, so it's gonna go farther as it continues, at which point it can cause a loss of equilibrium, hallucinations, seizures, and confusion. The infection is incredibly rare, but on the flip side, the survival rate is also incredibly rare, with less than 2% of people surviving it. Most of these cases occurring from swimming in warm lakes or rivers. Brain-eating amoeba is very rare, with less than 10 people getting it in the US a year. Cyclopia is a rare congenital disorder in which a baby is born with one eye located in the center of the forehead, often accompanied by other severe malformations. Cyclopia is usually fatal. Cyclopia is quite rare, occurring in 1 in every 100,000 infant babies, and none of them live long. The longest one has ever lived, to what I could find, was only 13 hours after birth, and this is one I don't think I can even show because it's quite graphic. Botulism is a rare but serious illness caused by toxins produced by the Clostridium botulinum bacteria. It can cause paralysis and respiratory failure if left untreated. The most common form of botulism is infant botulism, which happens when botulism spores get into the infant's intestines for reasons we're not entirely sure of. Another form that is probably talked about a lot more is foodborne botulism, which can fester in improperly preserved food. Botulinum toxin, the most potent toxin known to humans, is also used in tiny amounts of Botox treatments to reduce wrinkles. Botulism is very rare, with only 1,000 cases a year being reported worldwide. Fish odor syndrome is a metabolic disorder where the body cannot break down trimethylamine, a chemical that smells like rotten fish. This leads to the person emitting a strong fishy odor, which particularly happens after consuming foods like fish, eggs, and legumes. Fish odor syndrome is mostly genetic, but it can also be contracted. Fish odor syndrome affects the way the FMO3 enzyme is able to break down trimethylamine. Normally, the enzyme breaks down this chemical when we produce it, so it doesn't smell as bad. People with fish odor, though, are unable to do this, which can lead up to a buildup of trimethylamine and thus makes the infected person smell like fish. People with fish odor syndrome often suffer from social isolation due to the persistent smell, and there being no definitive cure for this condition. Fish odor syndrome is very rare, with 1 to 5 cases per million people worldwide. Harlequin Ichthyosis is a severe genetic skin disorder where a baby is born with thick, hard, and scaly skin. This condition often leads to serious complications, including infections and dehydration, due to the skin's inability to function properly. This is also another one of those I probably can't show, at least in its infant form. Adults with Harlequin look relatively normal compared to the infants. The infants I just can't show. It's not something you want to see either way. Babies with Harlequin Ichthyosis often have severe facial deformities and can include lips that are turned inside out, giving them the Harlequin appearance. Harlequin is another very rare disease, occurring in 2 to 3 cases per million people worldwide. Kuru is actually interesting. It's a rare and fatal neurodegenerative disorder that was historically found in the Fore people of Papua New Guinea. It was transmitted through cannibalism, particularly cannibalism of the brain. So the traditions of the Fore tribe to practice ritualistic eating of the brains of their deceased relatives didn't lend well to preventing this disease. The reason they would eat the brains in the first place was meant to be symbolic of having a part of the deceased relative inside you, because they knew that the brain was basically your consciousness, and so they thought when you eat the brain, or at least a piece of the brain, you have a piece of them inside of you. The spread of Kuru was halted when the Fore people abandoned cannibalism. It's one of few diseases that was directly linked to a cultural practice. Kuru doesn't happen anymore since people don't eat each other's brains in the wake of knowing what this was caused by. Tree Man syndrome is another really interesting one. Tree Man syndrome is a rare genetic disorder that causes people to develop extreme warts and skin lesions, particularly on their hands and feet, that resemble tree bark. These growths can become large and quite disfiguring. Didi Kozwara, a man from Indonesia, became famous worldwide as the Tree Man due to his severe case of Tree Man syndrome, and he underwent numerous surgeries to remove over 13 pounds of the warts. Tree Man syndrome is super rare, with only around 500 cases existing around the world. Progeria is a genetic disorder characterized by rapid aging in children. Most children with progeria appear healthy at birth, but then begin to age rapidly within the first 2 years of their life, which leads to premature death due to heart disease or stroke. Children with progeria generally only live into their teens or early 20s, despite their bodies aging at a much faster rate than normal. Progeria is super rare with an incidence rate of about 1 to 2 in 8 million, though if you've already had a kid with progeria, the chances are far higher, at about 2 to 3% that you will have another. Stone Man syndrome is a rare genetic disorder where muscle tissue and connective tissue, such as tendons and ligaments, are gradually replaced by bone, which leads to immobility. The disease causes the body to essentially grow a second skeleton, and surgery to remove the extra bone actually worsens this condition, which leads to more rapid bone growth. Stone Man syndrome is super rare, with 1 in 2 million people being found to have it, though it could be higher since it can be missed. Anencephaly is a severe birth defect where a baby is born without parts of the brain and skull. Babies born with anencephaly are usually blind, deaf, and unconscious, most not surviving very long after birth. Anencephaly occurs in about 1 in every 4,600 pregnancies in the United States, and there's no known cure or standard treatment. Anencephaly is still uncommon, but it's definitely more prevalent than the other diseases on this level. My only theory to it being this deep would be the fact that most of the time the baby with anencephaly dies of it. At this point, we'll basically be talking exclusively about prion diseases. Prion diseases cause proteins in our brains to fold. We still aren't entirely sure about the role of prions in our brain, but what we do know is that the misfolding of these proteins will always eventually kill you. So, going on to Creutzfeldt-Jakob disease, which is a rare, degenerative, and fatal brain disorder caused by abnormally folded proteins called the prions. It leads to rapid neurodegeneration and death, usually within a year of symptom onset. CJD can also be passed down genetically in some variants. CJD can be transmitted, though, through surgical instruments, organ transplants, or even human growth hormone sourced from cadavers. CJD is super rare, with 1 to 2 cases per million people a year. Mad cow disease is a neurodegenerative disease in cattle caused by prions. When humans consume contaminated meat, it can lead to variant Creutzfeldt-Jakob disease, vCJD. The mad cow disease crisis of the 1990s led to widespread panic in Europe, particularly in the UK, and it resulted in the slaughter of millions of cattle. Mad cow disease, though, rarely ever happens anymore. vCJD is a form of Creutzfeldt-Jakob disease that is acquired by eating infected beef contaminated with prions, as I mentioned before. It leads to rapid mental deterioration, muscle stiffness, and ultimately death. vCJD emerged in the UK during the mad cow disease outbreak, and there is currently no cure. Cases have been detected worldwide due to global distribution of beef. vCJD is more than super rare, with only 233 cases being reported since 1996. Fatal familial insomnia is the last disease on this iceberg, and it is a rare, inherited prion disease that affects the brain, which leads to a progressive inability to sleep, and over time this leads to hallucinations, dementia, and then death. Patients with fatal familial insomnia experience complete insomnia for months before their inevitable death. The condition is so rare that only 40 families worldwide are known to carry the gene mutation. And with that, we're done with the diseases iceberg. My intention with this project is not to fearmonger about these diseases, because as I'm sure you saw, these diseases are not all that common, and the ones that are very easy to treat or are just not that serious. My intent was to bring awareness about these diseases that are the undoing of some people, and I've had people in my comments talking about what diseases on the iceberg they have and how they just don't get the correct representation they deserve in the media, often sensationalizing their suffering or lack thereof. And I hope to be a source of decent information on these disorders, despite the fact that some of my descriptions for these diseases were less than 40 seconds. I hope it can at least be the start of better research that you might decide to do on these diseases. Now, slightly off topic is that I came across an iceberg of banned movies in the United States, and I was wondering how interested you guys would be in that. And I am totally down to cover more icebergs, since this is the most proud I've been of a video in a long time. And also thank you guys for 21,000 subscribers. It really does mean a lot to me, and I've decided I'm gonna be more outward in my appreciation for you guys, since I am very fortunate to have an audience that likes what I make, and that I'm in a position where I can talk about what interests me, and over 21,000 people are into that. And With that, I have been John X Woodcat, and I will see you in the next video.